Veronica Galligan. I'm the Community Relations Representative for Prominence Health Plan.
Veronica, tell us what's been happening today here at South Texas College's Allied Health Facility.
Very exciting things are happening at today's South Texas College. We are having a Prevent, Beat, Treat Diabetes Symposium. It is a 2-day event. Today we're focused on educating children from the Rio Grande Valley on preventing, beating, and treating diabetes. It's very important to touch our youth at a very young age because they are the future, and we want to make sure that they understand how to prevent, beat, and treat diabetes here in the Rio Grande Valley. So today is a perfect opportunity to do that. Tomorrow we're scheduled to host an event for the adult population, and so we are hoping that we capture our adults in the community who can come out and learn more about preventing and beating and treating diabetes in this area.
First of all, tell us a little bit more about Prominence Medicare Advantage. What does your group do?
Prominence Medicare Advantage Plan is a health plan for seniors 65 and older. So those individuals that are on Medicare or receiving Medicaid services qualify for a plan. You must be 65 or older to be and retired in order to receive the benefits, or if you are disabled and you've been on disability for 2 years, you also qualify for our health plan as well.
Okay, so going back to today's event, I attended a classroom setting. There was a doctor, Dr. Ashley, and she was giving advice to the students, and what was surprising for me is many of the students knew all about diabetes. Maybe they had family members with diabetes, they knew what food to eat, and they knew a lot about prevention. So that being the case, if that was representative of the Valley as a whole, why do we still have an issue?
Because it really boils down to the individual making the change. Our culture is Hispanic culture. We're very stubborn. We are very proud of our culture, and we have a lot of rich foods that we eat in our culture that are being fed to the children younger in the community. And so it's really about starting at the younger age level, but it's really about change. The individual has to change, drastically change. Their lifestyle has to change, the way they eat, the way they move. Everything has to change in order for diabetes to be effective and for people to prevent diabetes.
Is the Rio Grande Valley, the border region, because it's more Hispanic, is this a bigger problem? Diabetes is a more pressing issue in our region than other parts of Texas or other parts of the U.S.?
Well, so if we are considered the fattest region in the nation, we are going to be chronically ill individuals here in the Rio Grande Valley. So diabetes is not just one of the problems. There's arthritis, there's heart attacks, there's strokes, and it's because people don't take action on their health. And the only way they're going to take action on their health is if something drastic happens to them, unfortunately.
I don't want to hear that the fact you just gave me that our region is the fattest in America. That's not good news.
No, it's not. And we have been the fattest region for a number of years, and it still doesn't change. So government has to get involved, cities have to get involved, schools have to get involved, parents have to get involved, grandparents have to get involved. It takes a village, it really does, in order to prevent, beat, treat diabetes.
So you've had your booth here throughout the day, and you'll be here tomorrow for the community event. What's the feedback you're getting? Are people coming up to you? You're trying to educate them, but what are the children telling you?
So the children are very excited because they're getting a wealth of things that we're offering today, from painting classes to they get a chance to enjoy a very healthy lunch. We're teaching them about different types of diabetes, whether it's type 1, type 2. Just a lot of education. We're bringing in physicians who can actually talk to them at their level and let them know how to stay healthy and live a healthier lifestyle. So then when they go home today, they're probably going to tell their parents, don't eat these foods, because I learned that at the Prevent, Beat, Treat Diabetes Symposium.
So what I learned today, another sort of startling fact, is I was told that type 2, type B, diabetes never used to be prevalent with children, but increasingly it is. Do you know about that?
I do. I've had children myself, and so it's real important for prevention and health and wellness to start at the home when the child is young. And as being a Hispanic mother, growing up in a Hispanic family that ate all the Hispanic foods that were not very healthy for us, I made those changes within my children, and I implemented exercise into their lifestyle, and that made a big difference. And I also got involved with the school district. I served on a School Health Alliance Council committee, and that made a big difference because we were able to make huge changes, like change the menu, make sure we implemented exercise at the level of elementary age school. And as they get older, they'll understand that those are important factors. And so hopefully with that in mind, people will actually take action and start getting involved and talking and making that change.
So the students were asked today, the students I saw, give us an example of a sugary drink, and everyone's hand shot up Coke. So again, the students seem to know what the issues are here. So is there any data out there that says we are on a sort of a better curve, and it's not getting worse, but it's leveling out, getting better? How are things looking?
Well, it's not getting any better because there's still diabetes in children. It really starts at the home, and it's basically the parent saying you only have two options. You either drink milk or you drink water, and that's it. And removing the soft drinks, because really soft drinks make people fat, and people need to understand that. There's a lot of sugar in a soft drink that if you do not burn that sugar, it's gonna turn into fat. And that will definitely affect you as you age and as you grow older. Yeah.
I have to say, Veronica, this is sort of a depressing interview. You're laying it out there, you're telling us how it is in the Valley, and we've got a massive challenge on our hands.
We do, but people don't change, and that is what's very frustrating, because we do wonderful things like this, Prevent Beat Diabetes, that we put our heart and soul into it, but people don't change. And we can paint the world beautiful, we can have as many symposiums as we want, but people have to make the change in order to improve the health for our individuals here in the Rio Grande Valley.
Well, I think your very impassioned interview today will get a reaction, and so if people want to learn more, how can they contact your group to learn the do's and don'ts?
So they can contact me at 956-821-9569, and I will be glad to navigate them through a process if they need support in fitness, if they need help with health care, if they need a doctor or a hospital system. I'm their support group, and please, people, you can rely on me. I'm here to help. I have no intentions of making money out of this. I am just here to help my community because I was born and raised here in the Rio Grande Valley, and I definitely take pride in where I live. And I want more than anything to help my community get better.
Well, Veronica, thank you so much for today's interview. We've learned so much.
Thank you.